The content of this podcast has not been evaluated by Health Canada or the FDA. It is educational in nature and should not be taken as medical advice. Always consult a qualified medical professional to see if a diet, lifestyle change, or supplement is right for you. Any supplements mentioned are not intended to diagnose, treat, cure, or prevent any disease. Please note that the opinions of the guests or hosts are their own and may not reflect those of Advanced Orthomolecular Research Incorporated. Welcome to Supplementing Health, a podcast presented by Advanced Orthomolecular Research. We are all about applying evidence-based and effective dietary, lifestyle, and natural health product strategies for your optimal health. In each episode, we will feature very engaging clinicians and experts from the world of functional and naturopathic medicine to help achieve our mission to empower people to live their best lives naturally. Several studies have found links between women's levels of day-to-day stress and lowered chances of pregnancy. Don't let stress interfere with your family goals. Cortisol Adapt contains ingredients clinically proven to help reduce cortisol and C-reactive protein levels, two biomarkers of physical stress. This formula combines well-known botanical adaptogens and proprietary extracts for optimal absorption, bioavailability, and clinical effectiveness. Pick yours up today at your local retailer or online at aor.ca or aor.us. Hello, everyone, and thank you for tuning in to another episode of Supplementing Health. We're joined again today by Dr. Sarah Zadek to continue our conversation about fertility for both men and women. Welcome back, Sarah. Thanks for joining us.
Thank you so much. It's good to be back.
Okay, so last week we ended off talking about conditions such as bacterial vaginosis and candida overgrowth. And so a lot of those things kind of start their onset when we're younger. And of course, when we're younger, our first priority is not fertility or getting pregnant in most cases. It's kind of a back burner. We're like, we'll do that when we're older, later in life, that sort of thing. But can this be an issue later on when people are finally ready to settle down and start a family?
Not necessarily. So the wonderful thing about the microbiome is that it's always changing, and every day it could look different, right? In general, the ratios of bacteria are likely to be very similar, day to day, but we can see pretty big changes over time. So this isn't something that's necessarily going to be detrimental to your entire fertility journey for your whole life. But it's something that if you start getting yeast infections in your early 20s, and maybe, by the time you're, 30 or 35, you want to start having kids and you're still getting chronic yeast infections, then that's something I would address. But if you had one yeast infection when you were 18 and you haven't had anything since, there shouldn't be any reason why, you would have a yeast problem that would potentially affect your fertility. Now, if you were on multiple rounds of antibiotics and never had a probiotic in your life, and you have a really poor diet full of sugar and really fast releasing carbs and low fiber, then maybe you're kind of creating the perfect storm for just proliferating bad bacteria, so to speak, and not letting the good ones proliferate and grow. So I think there is definitely room for treatment, whether you've had chronic infections or whether you're dealing with a current one.
Okay, and how early should men and women start preparing for conception or improving their fertility if they are starting to plan for a family?
Yeah, so we always recommend you want to give yourself at least 3 to 4 months of preconception work. And this is something that comes to as a surprise to a lot of people, thinking that they need to prepare, this far in advance. You can even start earlier if you want, right? I mean, it's never too early to start to prepare your body for conception, because all you're doing is making your body as healthy as it possibly can be. And like I said earlier, I mean, it takes an egg 100 days to mature, and sperm can take up to 116 days. So the idea is that you want to really follow those follicles, protect them, give them as much energy as you can, and all the nutrients that they need through their entire development, from when they are a tiny little follicle to when it's a mature egg. So I typically recommend patients start 3 to 4 months before you want to get pregnant, and start a preconception treatment plan.
Awesome. And some reports I've read say that egg quality can be improved with certain supplements. In your experience, is this true?
Yes, yes. I don't know that there's a definitive study that's out there currently that's reporting this, but just from our observations at the different fertility clinics across Ontario, we're seeing the patterns of definite improvements in egg quality and embryo quality when we do this type of preconception healthcare.
So, what are some of the supplements that women and men should be considering to help support their healthy fertility?
Yeah, so it's going to be different depending on the situation. In general, what you're looking to do is we're introducing antioxidants, specific ones that help to protect, egg and sperm DNA from damage. Um, we're also considering again vitamins and nutrients again to make sure that they have everything that they need. So, for example, like a prenatal with folic acid. Um, the whole idea is that, I mean, eggs and sperm need two things to be able to function properly and to mature properly. They need energy and they need normal chromosomes and normal DNA. So when those are lacking, that's when we have issues with both fertilization and embryo survival. So those are the things that we're trying to preserve. Those are the ones that we're trying to improve is giving eggs enough energy. So it could be in the form of CoQ10, maybe using carnitine to help to shuttle it into the cell. We're also using, again, antioxidants like N-acetylcysteine, um, and alpha lipoic acid, again, to help to support that as well. In some cases, we might be looking at, fish oils and the role of certain anti-inflammatories, or again, depending on the picture. So again, part of it is very person specific, and the other part of it's just giving eggs and sperm what they need.
Okay, and so you mentioned that for some, the issue is less about the initial conception and more to do with the implantation or fetal development, resulting in early miscarriage. So, what are some of the most common causes of an early miscarriage that people can address?
So an early miscarriage is usually due to egg quality. Whenever we see a miscarriage in the first trimester, it's usually because of a poor embryo quality, and this could be, from the sperm or the egg. Unless we've done testing on it, we don't know for sure. So again, some fertility clinics can start to test this. Yeah. So early miscarriage, we're looking at improving egg quality and chromosomal integrity. We really want to use that time to protect the DNA in our eggs and our sperm. So for men, we might be looking at testing for DNA fragmentation in sperm. Um, as far as women goes, we get a lot of clues also from our blood work. Basically, how is estrogen and progesterone both in normal ranges, right? So that's also giving us an indicator of egg quality. So, for example, if we have low progesterone in our luteal phase, which is the second half, which could cause a failure to implant. So remember, progesterone is the hormone that helps to thicken our uterine lining. And this progesterone is actually secreted by the corpus luteum, so part of the egg, in a response after ovulation. And so that progesterone thickens the lining and prepares for that embryo to be able to implant. Well, if you have low progesterone in that luteal phase, it's often an indicator that we have a poorly functioning corpus luteum. That egg is not able to produce the progesterone that we need to thicken the lining. And so without a proper thickened lining or a prepared lining, we will have problems with implantation.
Okay, so could the use of hormonal contraceptives or even a previous abortion affect fertility or that implantation?
Okay, so two things there we'll unpack. So the first is the birth control pill. So the birth control pill doesn't necessarily, or hormonal contraceptives, I should say, in general, don't necessarily cause infertility. What they do though is that they mask the whole picture. So for the average person, and on average, I'm finding a lot of patients have been on the birth control pill for up to 10 years at a time. Well, while you're taking that pill, you're suppressing all your normal hormone function. So if there is a problem going on, we don't know about it until you stop taking, your birth control and you start to have normal actual like real cycles, and we start to see what your actual like your endogenous hormones are doing. The other thing about the birth control pill is that it does take a lot of energy to kind of deconstruct and detoxify these hormones out of your body. So we have to keep that in mind too when it comes to liver function, especially in someone if there is already a predisposition to any type of liver issues, whether it be fatty liver or PCOS or whatever the case may be, high alcohol and smoking consumption. Those will all factor into it. Now, as far as abortions go and different types of procedures that we have on the female reproductive system, even something, D&Cs, LEEP procedures that women have for cervical dysplasia, anything that's going to cause like a physical trauma to the endometrium or the cervix, both can impact fertility. So in our practice, what we do is we actually have kind of cervical healing protocols that we put into place to help to kind of regenerate and kind of help the healing and decrease inflammation of the cervix and within the uterus. So could these affect implantation? Absolutely. If you have scar tissue from a D&C, that's going to affect implantation. If you have fibroids or polyps, anything that's physically there, cysts can all affect fertility. It just depends on their size and their location. You could have, a cyst on your ovary and not have it impact fertility, or you could have, a cyst compressing your fallopian tube, and now you can't ovulate from that side as well. So it's all very kind of situationally specific, but all of these will contribute to fertility. And that's what we do here is in fertility clinics, across the country, is we're looking at investigating, why isn't someone getting pregnant? Is it a problem with fertilization? Is it a problem with the implantation? Trying to figure out, is it hormonal? Is it immune related? Is it all of the above? And so all the investigations that we do are trying to kind of decode that and re-explain unexplained infertility.
So, if you get a scar on your skin, things like vitamin E can help reduce that. Are there certain things you can do to reduce scar tissue if you have had some of these procedures that could help improve that possibility of proper implantation or reduce the issues?
Yeah. So again, it really depends on the location of the tissue and what we're trying to do. If you had abdominal surgery and or any type of pelvic type of surgery, there could be scar tissue there. And in some cases, again, depending on the location, it might be you might be able to reach it as far as doing a physical therapy. So say like acupuncture or a physiotherapy where you can break up that tissue. Pelvic floor physiotherapy is great for that as well. As far as supplements go, yeah, we use different types of anti-inflammatories. Vitamin C, bioflavonoids are both really good ones for that as well. Certain types of dietary oils like omega-3s can help as well. Zinc is a really nice kind of immune supporter as well. And like you mentioned, the vitamin E, right? So again, it really depends on where the damage is and how much, like what we can do to resolve it.
Okay, and then jumping back to the conversation about the hormonal contraceptives, I know you had mentioned people have stayed on for as long as a decade or even maybe more. So how long on average, does it take for a woman who has been on these hormonal contraceptives for a significant amount of time to return to her natural cycle so that you can start seeing any issues that may exist?
Yeah, that's a really great question because it does vary. A lot of my patients will get their periods back pretty much right away, and we always get that first period after you stop birth control. I'm always really wary of. It's never. I don't know if you would call it a true period. I like to wait for the next one after that, as a better sense of what your body's doing with its own internal endogenous hormones. So in other cases, like for example, for myself personally, when I came off birth control, it took me 6 months to get my period back. So I had no idea what was going on. I just wasn't getting a period and I kept waiting for it to show up again. So, and eventually, again, like after 6 months, it did happen. But I use that as almost like a cautionary tale as far as if you're unsure what your body's going to do after you stop these hormones, which are synthetic hormones, plan earlier. Like if you want to get pregnant, say this year, but you're coming off of, birth control pill, give yourself those extra few months just in case, because you don't know how your body's going to react. You could get a normal period back right away and get pregnant the next month. And I've seen that happen very often. But again, then I look at myself and say, well, it's also possible that you might not get a period for months at a time, and you just don't know when it's going to come back. So I always say plan ahead. The earlier you can start, the better.
Okay, and oftentimes when people speak about infertility, it's in the vein of women's health and women's hormones and, more on the female side of it, things. So how common is male infertility?
It's actually more common again than we think. It takes two, right? When we're looking at embryo quality, I mean, an embryo is half the DNA from sperm and half the DNA from, an egg. So we are finding, like, I would probably estimate about 30% or so of cases are usually male factor. Um, that's just kind of like the average that I see. And I think that number is pretty close to what's been reported in the literature, though I think there's like a good 10 to 20% wiggle room because they're just, some cases are just not reported, or we don't know the reason. So I'd say approximately 30% are male related, and it's usually lifestyle or dietary related. It's all very easily fixable things. It's usually a male who's smoking or drinking a lot or using marijuana, or someone who's just not keeping up a healthy body composition. It's all the dietary and lifestyle things that I see.
So how is the health of semen evaluated then?
Yeah, so we do, it's called a sperm analysis. So the male will usually abstain from ejaculating for, 2 days or so. Then they'll bring in a sperm sample and it gets looked at under a microscope by the nurses, and they will do a sperm count. They look at the motility of sperm, so how well sperm can swim, and they also look at sperm morphology. And this means, the shape of sperm. So you can have defects in the head, the body, and the tail. So you can have, two heads on a sperm. You can have a short tail where it can't swim as well. You can have all these different morphological changes that affect the quality and the function of sperm. And then as far as the actual quality of the fluid goes, like I mentioned earlier, we're also looking at viscosity. So, how thick is the fluid? Does it look like it's coagulating? Like, is it sticky and all stuck together? Is there debris there? Or is it pretty fluid, where sperm can easily swim within that fluid?
Okay, so then for men who have a low sperm count or slower swimmers, I know you've mentioned a few things, but are there specific steps they can take to improve this?
Yeah, absolutely. I mean, like I said, there's definitely, when it comes to treatment, a lot of it is diet and lifestyle, but also supplementation. So we kind of take a similar approach when it comes to protecting the DNA of sperm. So the first thing is, again, looking at overall diet lifestyle, quitting smoking, stop drinking, no recreational drug use. And then from there, we really just want to make sure that, again, sperm have all the necessary nutrients that they need. So that's everything, everything from zinc and carnitine and arginine, to our B vitamins, right? Our folic acid, our B12, our omegas, kind of everything that, even CoQ10 as well, right? So everything that a sperm needs, one, to get enough energy to function and to protect its DNA.
Okay, so you had previously mentioned how immune factors can play into fertility as well. Do you mind elaborating on that a bit?
Sure. So when I talk about immune factors, I mean, one of the biggest, again, one of the more relatively recent reasons that we're finding for unexplained fertility is autoimmune conditions. So most commonly, I'm finding patients presenting with anti-thyroid antibodies. So these are, basically your body's attacking its own thyroid gland and causing dysfunction. That seems to be one of the more common ones, but I also have seen some cases of what we call anti-phospholipid antibodies. So this just increases the risk of blood clotting, right, and of clotting and having miscarriages. So the immune system and autoimmune conditions play a huge role in fertility, because we don't want the body attacking itself, especially when if you're trying to conceive and you're going to be carrying a pregnancy, those have to be controlled. And it's one of the causes of second trimester miscarriages is autoimmune conditions.
That's interesting. I didn't realize that. Um, so, what are some of the signs that make you question if it's an autoimmune issue?
So usually if I see repeated miscarriages, especially if they're later than 12 weeks, then we look to consider them. But to be honest, we're screening most patients now for the anti-thyroid antibodies because it's something that can be remedied pretty quickly. It's yeah, pretty easy to treat. Even dietary changes can make a big impact on antibodies. So um, studies are showing a gluten-free diet can decrease antibodies. So we're basically just screening patients for the thyroid antibodies, but anything additional to that, again, you're looking at someone who's had repeated miscarriages, especially if they're later in the pregnancy or second trimester.
Okay, and does inflammation or like CRP levels ever play into people's ability to conceive?
Inflammation, yes. CRP, I find is too general a marker. I actually don't even really use it anymore because I mean it gives you an idea of what's going on, but it doesn't tell you where the inflammation is or how bad it is really. So inflammation, I'm looking at what kind of problems are coming up because of inflammation. So, for example, someone with incredibly heavy periods, painful periods, endometriosis, anytime there's another like presentation of inflammation in the body, we're looking at that for sure. Now, not all inflammation is bad though, and I think that's really important to note. And this comes down to a couple of like the lifestyle things that we can modify for fertility is the anti-inflammatory use that we have. So, for example, your body actually needs a very small but very specific inflammatory signal to tell your body to allow the pocket that's holding your egg to release to ovulate it. So without that little bit of inflammation, your body actually doesn't release an egg. So you need that signal there. So for this reason, we actually recommend avoiding NSAID medications. So those are non-steroidal anti-inflammatory drugs like naproxen and ibuprofen. We want to avoid those around ovulation because they could interfere with the release of an egg. So again, not all inflammation is bad. It's when it becomes out of control and becomes very symptomatic that we want to get control of it. So
Now,
overtraining can do this, like over exercising can cause, inflammation of the body. You're feeling more sore, you're not recovering as well. That can definitely be it. Gut inflammation, right? When we're having looser stools, we're not, if there's inflammation in the gut, we're not absorbing nutrients as efficiently. So that's going to affect fertility.
okay, so how would a woman know she's in ovulation? Because not everyone has the same 28-day cycle, right? Everybody can vary from that. Some have slightly shorter, some have slightly longer. And even if you do have a perfect 28-day cycle, it doesn't mean your ovulation days are perfectly at day 14, 15, 16, right?
Mhm. Yeah, so some women will opt for using ovulation predictor kits, which are they're test strips which detect the hormone luteinizing hormone, which peaks right before you ovulate. I find that they're not always reliable though. They don't always get the readout that they're expecting. So like the line will be too faint or too dark, or it just will be wonky. Maybe they don't know. They'll get different answers on different days, and things get a little bit messed up. And these kits are really expensive. So for my patients, I usually say, like, if you don't have any LH strips or ovulation predictor strips at home, like, don't worry about it. There are other ways you can tell if and when you're ovulating. So one of the kind of at-home ways that I teach patients to identify this is it's a combination. So the first thing I do is I get them to take their temperatures. So it's called basal body temperature. And I have women, as soon as you wake up in the morning, but before you get out of bed, take your temperature. Log it into your cycle tracker app, or if you're just using paper and pen, you can do that too. But cycle tracking apps are awesome for this. And then so basically you're looking at the pattern of when your temperatures rise and fall. So what we're looking for is that in the first half of your cycle, before you ovulate, your temperatures are going to be at their lowest. And then you're going to have between, say, like a 0.4 and a 0.6 degree difference when you ovulate. So that temperature is going to rise a little bit and it's going to stay elevated. And the reason for this is because of the progesterone. So it's keeping that body temperature higher for you in hopes that you're pregnant. And then when your temperature falls back down again, it's usually when you get your period because you're not pregnant. So I think tracking temperatures is one way that we can get an idea of when you might be ovulating, but that on its own isn't not always accurate. And like the LH strips, you can kind of get different variations on what that chart might look like. So I pair that with visual inspection, visual and physical inspection of the actual cervical mucus. So it's not as complicated as it sounds. Basically, just pay attention when you're wiping, right? So approximately 6 days before you ovulate, you might start to notice changes in your cervical discharge or vaginal discharge. And as we get closer to ovulation, it'll become almost like egg whites. It'll be clear and slick, like very slippery. And if you were to hold it either with a tissue or between your thumb and forefinger, you should be able to let it stretch, and it should stretch like a good inch or so. It's really neat to see the first time you do it. But I find tracking your cervical mucus quality with temperatures together is a pretty good indicator of approximately when you're ovulating.
That's very cool. So if people have been following a lot of these preconception steps, so nutrition, lifestyle changes, etc., and they're still having issues with or struggling with fertility, what are some of the options available to them?
Yeah, so I mean, first of all, I would go in to see a fertility specialist right away, right? The big take home here is that not all OBGYNs are the same. Some have their own specialties and little niches that they like to work in. So make sure you're seeing, a reproductive endocrinologist or a proper OBGYN at a fertility clinic. So I think that's really important. Patients also have the option of doing something like acupuncture. And the research with acupuncture and fertility is growing very strong. It already is strong, but we're getting more and more studies as time goes on. So, seeing someone like a traditional Chinese medicine doctor or, a registered acupuncturist or an ND who does specific fertility acupuncture is also a great way to help to support fertility throughout this journey.
Okay, cool. So if any of our listeners wanted to get a hold of you directly to work with you or learn more from your expertise, how could they go about doing that?
Yeah, so you can use our website, conceivehealth.com. Our main location is in Toronto, but we have clinics embedded throughout Ontario from Kitchener, Waterloo, Barrie, Whitby, Thornhill, I believe, as well as is opened, and a few others. So conceivehealth.com has all of our information there, and you can kind of find out more about preconception healthcare. You can learn more about our individual practitioners and find the treatment plan that's right for you.
Awesome. Well, this has been amazing. There's so much information here. So thank you so much for joining me today. And thank you to the listeners for hopping on as well.
Great, thank you.
Thank you for listening to Supplementing Health. For more information about our guests, past shows, and future topics, please visit aor.ca/podcast or aor.us/podcast. Do you have a topic you want us to cover? We invite you to engage with us on social media to request a future topic or email us at marketing@aor.ca. We hope you tune in again next week to learn more about supplementing your health.